afternoon, everybody. Thank you. I would like to thank my professor, Dr. Iman, chairperson. I would like to thank all the Society of the Women Society. I would like to thank Dr. Marwa. I would like to thank all professors, all who are attending with us today. We are speaking about, my presentation will be short and to the point. I'm speaking about sustainability in ophthalmology practice. I'm an eye doctor. I work in the Research Institute of Ophthalmology in Giza, and you're welcome anytime to attend with us and see our institute. We have a lot of subspecialties. We have a lot of not only ophthalmology, not only eye doctors, a lot of ophthalmology, a lot of medicine, cardiology, ENT, info-ozone, pediatric also, and there is also and experimental lab, and you are welcome to attend and visit our institute. It's okay, let's start. We are a health professional. We are taking care of health of patients, so we have to take care of global health as well. So the earth is a fine place and worth fighting for. According to the World Health Organization, climate change is one of the greatest threats of the global health in the 21st century. Despite several actions, there is decreased awareness, and a lot of people don't know what we are facing and what we are expecting of our planet to be in many years, hope to be a lot of years coming. And it's a balance between sustainable ophthalmic practice, it's delivering disease, and as well minimizing the cost and minimizing the emission of our practices as well. It's okay, please, next, please. It is 5 fundamentals. It's 5 R's. We are speaking about reduce energy or reduce emissions, and reuse our sources in order to reduce our waste products, and even recycle, rethink, and research rule has an important role in minimizing it as well. Without research, nothing will happen and nothing will change as well. It's okay, please. What modification can be made in outpatient clinic? I'm going to talk about in outpatient clinic and as well as in the surgery room, in the operating room, operating theater. We take an example of COVID infection. ممكن قبل دي؟ لا اللي قبلها. It gave us an example of how green clinics be. I mean that we were all home, and how patients and how we dealt with patients while we are at home, and to be treating them well and safe as well, our safety and their safety as well. It gives us how to treat them and how to contact them and how to get our the signs and symptoms that we are searching for. So, in treating those patients on reusing minimizing our waste products, we use single or multiple examination tools. There is an increased trend in the use of single-use tools during outpatient clinic examination. It came with different costs, and it differ in the cost price, which is cheaper and which can be sustainable in use. It's okay. Next, please. Single or multiple. Here is a kind of eye drops which come in single dose unit. It is with low infection or minimal infection associated, but it's a single dose. It will be a little bit expensive, but it will be infection free, and it will be as easy as use instead of multiple use. Here we have a lot of papers and a lot of brochures and packaging. Here is a study that said that 15% of global health gas emissions came from these papers. So we tend to use QR codes instead. And if anyone wants any more data, he can just open the QR code and get what he wants from this. The other one, please. Different perspective on database regarding whether it's our debate in ophthalmology, which means we have a lot of investigations, which means I can get what I am searching for from this patient from different instruments. I am, as a doctor, I should be wise and should be asking for the least or the minimal devices I can use. Can you change? Let me tell you something. We are healthcare professionals. We are 4.4 to up to 5% of the global crime of carbon dioxide emissions. So let's reduce this 5% even. Reorganizing of outpatient clinic service. We prefer that first time patient come to us, we prefer him to be detailed ophthalmological examination. Not for the second and third, because we can get telemedicine with us and AI examination and AI modules, which we learn the patient what we give him camera even or handheld investigations, so we can learn him how to use it and learn him to send us his feedback as well. Can you change that, please? Telemedicine became widely used in our subspecialty, and teleophthalmology even. We made a lot of conferences as well. We can contact patients and get what we're searching for, instead of cost of patients visiting and cost of transportation and then a lot of cost. Okay, can you change it, please? Incorporating and AI and innovations in ophthalmology care. We have instruments that can be given, then we can give for patients at home, but it came with extra cost, and it's hardware that is not all patients are handy or can use it as simple as it is, but still it is an FDA approved, and we rely on it in a lot of patients. We can get what we search for in order to minimize what emission we can minimize. Okay. So what are healthcare professional views of sustainability? In New Zealand, ophthalmologists view sustainability found that the majority were positive about sustainable changes that could reduce cost and carbon footprints. 19% response stated that climate change was not caused by human behavior and did not need to be mitigated. More young ophthalmologists, broad-based political action was necessary for sustainability. They said so. Similarly, for U.S. ophthalmologists and nurses, 93 of them of their response believed they were produced in healthcare delivery and should be minimized, while 90% expressed concern about global warming. I think there is unawareness of the problem in itself, which need us to explain it to them and minimize, put our programs and put our healthcare systems for them, because they are unaware of it. Okay. Barriers to sustainable measure, most significant issue is there is lack of awareness and data as well, because if we get data, we will do our research work and we will get the problem and solve it. I think it will be much more easier. Many ophthalmologists and healthcare institutes are unaware of the environmental impact of their practices. In addition, single-use instruments are preferred to reduce risk of infection despite increasing waste, although rescue may be possible in some cases. And here is the wise God, or wisdom, the God of wisdom. Yes, thank you. Thank you. I almost finished. Concerns about quality and safety also exist. Another issue is absence of incentives and policy support for sustainable options. Furthermore, many ophthalmologists and nurses believe that workplace policies hinder sustainable practice, and I don't know how. They try to change what is going on, and they are resisting to change, but hope this era will end. Thank you. So, okay, we can change. What action can be taken? We have to follow the footprints of carbon in our practice and eliminate them one by one. Of course, future studies should examine energy use specific to ophthalmology and create more environmentally friendly practices. Ophthalmology and AI-assisted examination present promising solutions. Public interest. We are delivering a service, and we should concern about public interest as well. And okay, I will finish. Finally, sustainability efforts must consider low and middle income countries' realities. Research that consider local needs, resources, and cultural factors may help develop strategies that are more applicable on global scale. The footprints of carbon, hope to trace it. We need a better environment, a better green planet or something like that. And here is a little bit of Egypt, and you are welcome at our institute. Thank you.